Hello, you're watching the Hub Online Network. My name is Gareth. We got another full show for you guys today, so let's not make you wait in suspense anymore. Let's get to it. All right, it is Friday. It's the end of the week, and we are joined by David Dirksen. How you doing, David?
I'm doing well today, Gareth.
David is in the studio today to help me talk about what's going on in the medical world in our area, as well as some areas abroad. There's lots of interesting things going on in the interior in dealing with the medical sector, I suppose. So we're going to see what David has to say today. So David, you, again, are heavily involved in this kind of stuff. So what's new and exciting in the world of medicine?
Well, on Tuesday, we had the presentation by the Primary and Integrated Healthcare Innovations Network, and they've been doing, for the past 15 or 16 weeks, have been doing quick COVID surveys of both patients and medical practitioners, and they've been following the impact of COVID on primary care. And as well as that being done in 11 of the 14 healthcare jurisdictions in Canada, it's also being done in Australia and New Zealand, several countries in Europe, South Africa, and a number of places in the United States. And so it was really quite shocking to me that you could have taken the numbers from any one of the countries or any one of the provinces and laid it on top of the other, and they were almost identical.
Right.
And so there are some things that I think we all need to be aware of. And one is the amount of stress that the medical professionals are under because of COVID, because of the fact that they can't meet with their patients in the usual way. They're having to find and create all kinds of new ways of doing that. They're having their own doubts about whether they're doing that effectively. They have a lot of patients that are intentionally choosing not to get the help they should be getting. And that's frustrating because that's going to create more stuff down the road. And so there's this snowballing effect of stress that's really going throughout the thing. And surprisingly, the patients are in about exactly the same space because they don't know what to do or how to do it either. And so we're learning about that, but in the process of this, we're getting to, what they're calling some really heroic situations where in the first week of the survey, 85% of the clinicians didn't have any way of contacting their patients. Now that we're in week 16, 95% have contact with their patients on a regular basis, either by telephone or by email or by video or a combination of those things, and are now being able to appropriately see people in clinic when it's appropriate.
Right. So one of the things that we've done here, so all that being said, one of the things we've done here maybe 2 months ago, was we talked with Dr. Stephen Akakumi. He came into the studio. You can, for people at home, you can check out that interview on the Hub Online Network's YouTube channel. But at that time, he was having troubles getting patients to come in and sign up with him. Has that changed at all over the last 8 weeks?
It's slowly starting to improve, but you have to understand that this was the perfect storm of inappropriate connections, because Stephen started on the 15th of March, and we had to close the clinic on the 16th. So he had 1 day to attract patients. And so what has happened with that is Dr. Humber in Lillooet and the doctors in Lillooet have taken Dr. Stephen, and they're using him to give themselves some time off and some relief and things. So he's working in the ER both in Lillooet and here. So he's slowly being able to earn a little bit of income while we're in this transition period. And he's done some really good advertising, and there was your interview and an article in the journal that have started that flow of patients. But normally when we bring a new doctor in, we think it's going to take between 3 to 6 months for them to get to about 60% of a patient load.
Right.
But for Dr. Stephen, I think he's likely only at about 20 or 25 still. And we know that there are enough patients out there in the community that aren't attached to anybody that if they would get attached, he could have a full patient load now.
Right. What are some of the other... So, let me take a step back here. One of the things that I've always wanted to know, and I've seen you several times now, and I've never asked, is how did you become involved in the medical community, and what is your actual current involvement in the medical community?
I think the best term for me is a friend of the medical community. I have a passion for primary care, and by primary care, I mean what we do to stay well, what we do to stay healthy. Right now, we don't have a health care system. We have an illness care system. Because in order to go see a doctor and for the doctor to earn money, you have to have something wrong with you. Okay?
Right.
So the doctor doing things to keep you well rarely brings that doctor any income. And so I think that we need to turn part of that around. Now, please hear me. I really believe that we need the Royal Inland Hospital. We need the hospital in Kelowna. We need those, specialists and all of those things. But the thing that we need is community-based primary care where we're working with patients to keep them well on an ongoing basis. And research has shown that when you do that aspect of it, the acute care costs, the costs of places like Kamloops, drop by anywhere from 25 to 40%. And that's significant if you look at our healthcare budget. Mm-hmm. We're not talking peanuts here, okay? We're talking significant money. And so when we first got to Ashcroft, my wife Alice got elected to council, and they went to a rural health symposium in Clearwater. And after that, Alice asked, rather than going to UBCM, if she could go to the Rural Health Workers Conference in Prince George. And I went along with her to that. And then Mayor Andy Anderson, who was mayor at the time, asked Barb Shaw and myself if we would help with the recruiting of doctors. And so it's sort of grown from there.
So people at home that are watching, I'm sorry if I'm really surrounded by a bunch of stuff right now. Everybody else from the team is in Lillooet, and one of the things that we discovered on Tuesday during our show is that I have to be really close to this microphone if people want to be able to hear me properly. So anyway, that's why I have all the gear on my desk. So one of the other things that you have brought to my attention today, let me just bring it back up here, was the Patient Voices Network.
Right.
So I'm just going to read a little bit of this article. So the Patient Voices Network is a community of patients, families, and caregivers working together with healthcare partners to improve BC's healthcare system. The PVN connects patient partners with healthcare partners who are seeking to engage the patient voice in their efforts to improve the quality of care. So, you sent this to me, so I'm assuming that you find this to be very significant. Can you explain a little bit more about what this is and what it means?
Yeah, I joined, I don't know, it is 5 or 6 or 7 years ago, I became a member of the Patient Voices Network. And they have a number of projects that they're working on. Everywhere in British Columbia right now, everything that's being done has to have a patient voice on it. So if you have an administrative committee in Interior Health, there has to be a patient on it. If you're doing a thing. So right now, I have served on the British Columbia Transport and Transfer Working Group, which is a combination of the transport leads from each of the health authorities and the BC Ambulance Service. And they meet usually about once every month or 6 weeks. And they've been working on a number of things. And 5 years of being on that team, back in April, you would have heard the announcement about the improved northern airplane and helicopter and ground transport system for Northern Health and for Interior Health. And that was work that was done by that committee over a 5-year period. And it's likely not the politically correct thing to say, but we were pushing for this to happen. And COVID opened the door, and it came through and landed beautifully. And so our rural transportation for patients is showing a marked improvement. And again, there's ongoing research to prove that it's effective and that it's working. So that was one of the teams I've been on. I'm also on the UBC Dean of Health has a Rural Advisory Council because of the fact that almost everything in health, like if you look at it, Interior Health is considered a rural health authority, and yet almost everything is in Kelowna or in Kamloops. And to me, those are not rural places.
Right.
They're surrounded by rural, but they themselves aren't rural. And there's this real urban mindset that affects healthcare. And so I really try and be involved in those things that are bringing that rural focus to it, rather because it's not mini urban. It's a whole different thing and a whole different way of looking at things.
Okay. Well, how many committees are you actually on?
A new one today.
Really?
Yes.
Oh, geez.
Let's see. I think I'm actually right now working on 7 actively.
Okay.
Okay. And the one that has spawned 3 others is I'm on the patient advisory for the BC primary health care research network. And so that is the group that is connected to the Primary and Integrated Healthcare Innovations Network. And that's the group that is doing the quick COVID studies and that have been interacting on Zoom once a month or once every 2 weeks since May in order to coordinate all of this, because we don't need to reinvent the wheel. We just need to know what's working and be able to translate it into our situation.
What do your groups encompass? Meaning, like, if they were to go from, what's the spectrum of what the groups cover?
Okay. Well, first of all, let me go back half a step, if I may. Okay. Dr. Granger Avery introduced me to the concept, what's called the pentagram partnership. It's actually morphed from the pentagram into a hexagram. So it's a 6-sided star instead of a 5-sided star. So every committee, everything I work on has representation from the 5 points of the star. So that's policymakers, that's health authority administrators, it's I wasn't planning on having to remember this.
Sorry to do this to you.
It's okay. And patients, it has to have health professionals on it. It has to have a researcher on it. And it has to have somebody from the business community. So I believe those are the 6 points of the star. So we have to bring all of those different voices to the table, and then we look at the issues that are on the agenda for that particular team. So with the UBC Dean's Rural Advisory Council, what we're looking at is how do we train all of the different health professionals in a way that qualifies and equips them to be ready to serve in a rural community. And how do we do that in a way that they understand the validity and the value of a rural practice? Most doctors end up going and serving in a community that is similar to the one where they did their residency.
Right.
And all of those until a few years ago were urban. And we're now starting to get those to be rural. And so as we expand that and have more doctors doing their residency rurally, we'll have more doctors staying rurally. And the same is true with nurses and dietitians and physiotherapists and all of those things. We have to be able to find a way of bringing them out here and doing that introduction and making them part of a team in a rural setting, and for them to be able to experience that.
You have a bunch of papers in front of you. I'll let you talk about another thing that you want to talk about before I ask you another question.
Well, no, the papers are here just in case we want to look at things. One of the things that's really a stressor for not only our doctors here in Ashcroft and our doctors in Lytton and Lillooet is in this whole pandemic thing, practice has changed. And so what we have to do is they have been responsible for obtaining their own personal protective equipment. But the personal protective equipment that they have to use has been mandated, so it's not optional.
Okay.
Okay? But nobody opened the storeroom for them to be able to get at it. And so it has been really, really hard and very, very expensive for them to be able to get the PPE they need in order to be able to see patients. Now, add that to the fact that basically for the first month they didn't have income. Okay? And now they're having to get the PPE, and now they're trying to get their patients back, and they're working with things, and when they're having appointments now, half the time they don't know whether they're going to get paid for that consult or not. But that in BC is actually working out quite well. The ministry and the health authorities have been really doing what I think is an excellent job on that. On Tuesday on the summer education series, we heard from an American researcher, and the stresses on the system down there are just absolutely incredible. Like in many places in the States, rural hospitals are simply having to close. And you know, here we've been able, you know, because of the health authorities and because of the way our doctors work with the health authorities and with their own practices, it's been easier for us to sustain some level of work with that. But that's been one of the things. And now what we have to do is we have to make sure that those virtual billing codes remain, but we also have to really work quickly to clarify the guiding principles for being able to have in-person visits for the patients, because there are a lot of things where the doctor and the patient really need to be in the same room. You know, there's certain things you just can't do over the telephone, over a video conference link. And so we need to work on those, and those protocols don't exist. But because of malpractice insurance and all of those kinds of things, we have to get those things in place really, really quickly so that the doctors can comfortably be with their patients and not have this threat looming over behind them.
Are bigger cities facing the same sort of challenges that we're facing, or is it just us?
No, well, that's one of the things about COVID. It's absolutely no respecter of geography or class or anything else. So the medical clinics in the urban areas are facing the same stress as we are. In fact, some of them are likely having even more stress because, unlike here, we have a sense of community and we sort of tend to pull together and work together much easier. And in the urban areas, quite often, none of your patients will know anybody else that's a patient of yours. Right. Whereas here, we're all neighbors, and you know, so it works. So there are some advantages for us, but the stresses on the system are absolutely everywhere.
So you are on all these committees. Do you have, and you're a strong advocate for all of these things, do you have a person or group of people that you have that back you up, or are you kind of a lone crusader in town?
Well, I guess I don't think I'm a lone crusader because there's a lot of other people doing good things here in town as well, okay? But one of the other, you asked about other things I'm on, there is a primary care patient voices group that has just started in the last 3 months. And it is a group of people like myself that are really committed to the transformation of our system from an institutional system to a community-based, patient-centered system. And we get together once a month and support each other and learn from each other about what's working. And there's some communities that are farther ahead than we are and some that are behind. And so we're learning a lot from that and being able to bring that back and work with our doctors and other medical professionals to be able to bring those things here so that we can integrate them and not have a real horrendous, you know, learning curve.
Hang on, I have a question, but I have forgotten my question.
Okay.
Oh yes, okay, so if you had, so let's say you have 2 years.
Right.
Okay. What is one thing that you feel should be accomplished unequivocally in the next 2 years? If there was one thing that you could pick of all the things you got going on that you think would help rural medicine the most, what would that be?
Well, it'd be fulfilling the ministry mandate for team-based in-community primary care. And so that means that we would be working with our doctors and all of the other health professionals to create an integrated team that involves mental health, home care, all of the different things. You know, the dentist would be at some of the meetings, you know, the massage therapist would be there, the chiropractor would be there, the doctors would be there, the nurse practitioners would be there, and those people would all be working together, and we would have a single patient record, and all of those people, when they worked with a patient, the work they did would be inputted onto the patient record so that the others would know what was happening. Okay? I don't know about you, but I can't always remember what I told the doctor 3 weeks ago when I'm now seeing the specialist and he's asking me the same questions. Okay? So by having that integrated record, that would be part of that. That team-based approach would be part of that. And in a really ideal world, those professionals would all be working out of the same facility. So when you had to go for something, you would go to that place, okay? At the same time as that, because I really strongly believe in community care, for instance, with the Ashcroft band, they have a clinic there, they have one at Bonaparte, there's a clinic in Clinton. Some of the health professionals would serve the patients in those communities by them going into that clinic and meeting with them on video link. And at certain times, they would visit there and meet with the patients there. Specialists, for instance, I was at the respirologist a couple of years ago. I had an adverse reaction to one of the medications I was taking, and so I had some damage done to my lungs, and so I was in at the respirologist's office. There were 5 people in the waiting room, and they were all from Ashcroft. And that immediately said to me, why don't we have it set up so that the primary care clinic, the primary care network in Ashcroft, is aware of all the people that need to see the respirologist. Let's make those appointments and then get the respirologist to come out one day, and he'd be able to see 20 or 25 patients for one trip to Kamloops, or one trip to Ashcroft from Kamloops, rather than there being 25 trips to Kamloops for the same thing.
Well, think of how much gas would be, how much less gas would be used, how much less money would be spent.
Great for the environment. I mean, excuse me. And it's also great for the patient's pocketbook. You know, I mean, it's not necessarily cheap to drive into Kamloops. You know what I mean?
Being a person that has had several different medical issues over my whole life, and now over the last 8-9 years living in Cache Creek, all of the doctors I've seen are either in Kelowna or Abbotsford or Vancouver. So I've been driving a lot just to see a specialist. So yeah, 100%.
Yeah, I've had to go down to St. Paul's in Vancouver, and it's really interesting because they want me at the hospital at 6:45 in the morning. Well, that means I have to go down the night before, stay in a hotel, and they want me to stay for 2 days after the operation to make sure everything's okay, even though they don't see me. Okay? And so I'm there for 4 days, plus the drive.
What's amazing, actually, is that all of these things, again, are in Kelowna or down at the coast. There's nothing really significant in Kamloops, even, that can...
I got to correct you on that
Okay,
one. Sorry.
Fix me then.
Okay, I think Alice, whether she's going to be appointed to it or not, I don't know. They have a cardiac rapid access clinic at Royal Inland Hospital now. And so about 80% of the heart stuff will be able to be done in Kamloops.
Oh, that's exciting.
Yeah, and so they're looking for a patient voice to be on the advisory council for the rapid access clinic. So that's again one of the things that you get a notification if you sign up for and do the training to be a member of Patient Voices Network. Then about once every 2 or 3 weeks, you get a notification of all of the new things that are happening. And if something's of interest to you, you send in a thing, and that's how I got involved and how it's gone from one thing to another to the next.
Right. I don't want to keep you here forever, so I'm just going to ask you one more question for you, and then you can talk about whatever else you want to talk about.
Okay.
Looking at our legitimate timeline in the next little while, what are some actual things that are coming down the pipe that you guys are talking about in your meetings, if you're allowed to talk about them?
Yeah, well, the thing is we now have the Ashcrofton Area Community Health Table, and that is involving the communities and the people and organizations from just north of Clinton down to here and down to Spence's Bridge. So all of those First Nations bands and communities meet at that table, and we're just starting to meet again virtually. It was sort of hard because we've been having all of those meetings in person until COVID came around, and then the people from the health authority and the medical professionals that were part of that were all reassigned to COVID responsibilities, and so we've had to figure out another way of doing that. So we're working on that, and we have now established the Western Interior Collaborative Services Committee, and that is the committee that is actually going to make the application for us to be able to have a primary care network for our area. And when we get that application done and it gets funded, then we will be able to start building the team that I was talking about earlier and start working on the implementation of that, and we'll have some clear funding for wellness and health rather than just illness.
Oh, that's awesome.
Yeah, and I think, you know, I would like to see it done sooner than 2 years, but you asked about 2 years, and I would like to see us having our primary care network operational in 2 years. And that would be a 2-hub network with a center in Lillooet and a center in Ashcroft, and they would work together, and we would do a lot of sharing of resources and stuff like that. So people that were employed in Ashcroft would some days of the week would be working in Lillooet or one of the other community clinics around our region.
Right. Okay. Is there anything else that you would like to talk about?
Yeah, there's one thing, to me there's a myth going around with the whole COVID thing, okay? I think there's a lot of anxiety about how long it's going to last and everything else. And I think the important thing for us to realize is that COVID is a reality of the world, and it's going to stay with us, just like the flu stays with us, okay? And everybody has this mythical belief that when we get a vaccine, everything is going to go back to normal. Well, I did some research just in case you asked a question about flu and stuff like that. In 2018, 2019, and because we're just finishing the 2019-2020 flu season, so I don't have the data from that yet, okay? It takes a couple of months for that to be pulled together. So the 2018-2019 flu season was 5 weeks longer. It started 5 weeks earlier. No, it was 8 weeks longer. Started 5 weeks earlier and went 3 weeks longer than the 5 previous flu seasons.
That sounds like a very significant timeline.
I didn't have a chance to look into and find an explanation for that, okay? But that's the data, okay? The other thing is that in the 2018-2019 season, we had our highest coverage of people who had taken the flu vaccine, okay? Which was 40% of adults. However, or 42% of all of the population, which was a marked increase from, I think, 34% the year before. So that's a significant jump. But it was only 70% of the seniors got the flu vaccine. And I'm really proud of my fellow seniors, because that's really good news, because they're the most vulnerable, okay? So the thing is if we get a COVID vaccine, and we only have a 40% uptake on it, we're still going to have all kinds of outbreaks.
There's no way that the vaccine can be mandatory for people to take?
It can be, but would you want to be the politician who signed that order?
You're right, probably not.
You know, so I mean, it's one of those things. So, you know, I think, I would love to see us improve on that, okay? And I don't know how to do that. I don't want to get into a discussion of the anti-vaxxer movement or any of those kinds of things. I get the flu vaccine every year. I've been doing that for, 20 or 25 years since it first came out, because in my previous job, I had to visit in hospitals. In order to visit in hospitals, I had to have had the flu vaccine because I couldn't be bringing disease into the hospital. I mean, it's as simple as that. And so I think as a part of citizenship, it's something that we want to look at and do.
Do you watch a lot of movies, David?
I watch a few.
Do you watch a lot of medical movies?
No.
Well, there was a movie that came out probably, 9 or 10 years ago. It was called Contagion. And the story behind this particular movie is very similar to, oddly, scarily similar to what's happening with COVID.
Right.
Only it affects way more people die. Like, it's very Hollywood. But one of the things that they do in that is you're not allowed to go and buy groceries unless, like, once the vaccine is made in the show, you get a wristband saying that you've gotten the vaccine. Now you're allowed to go out and do stuff. Is that... Well, getting the flu vaccine, I feel, is different than getting the vaccine for COVID.
Well, about just under 1% of the Canadian population gets the flu every year, okay? And I wasn't able to dig out the number of deaths from the flu, okay? But the number of deaths from the flu are not that much smaller than the deaths we've had from COVID.
Right.
And our number of people that have gotten COVID is in that same percentage range, a little bit higher than that, but it's about the same, okay? So I think the flu vaccine is really, really important. And I think that most likely, because as it looks right now, what the evidence is at this moment is that the antibodies you get from having had COVID don't last in your system that long.
What do you mean?
Well, the antibodies keep you well,
Okay.
okay? But they get washed out of your system over time. And therefore, you can get it again.
Interesting.
You're not immune, okay? So I think they need to be working on a part of the flu vaccine needs to have a COVID component to it.
Oh, I never thought of that.
Okay.
Okay.
And you're going to need to do it every year.
Right.
But the thing that we don't know yet is flu is seasonal. It starts usually in October and it's usually finished in April. Okay? And whether COVID is going to be seasonal or not, we don't know. So those are the things that are there. But I really am concerned that people are seeing a magic bullet for this, and there isn't one. We are going to have to be aware of our interpersonal contacts with each other. We're going to have to be aware if we're seeing a stranger, we're going to have to talk with them and ask the questions, have you been exposed to anything that you know of? Have you had any symptoms in the last 2 weeks? All of those kinds of things are going to become a normal part of our discourse as we go forward. And, in the fall, we're going to have to find a way to do the flu vaccines because of the fact that we can't do them the herd way we've been doing them before.
All that being said, and I know I said I was going to let you go, but I'm going to keep you here for another few minutes.
It's okay.
The thing that came out today was the COVID tracking app.
Right.
In Canada.
Yes.
Now, everybody's phone on one of the last updates was given the precursor to this. I don't know if you'd seen that.
I don't have a new enough phone to have that.
That's fair. So for everybody at home on your smartphones, if you go into your settings and you go into your health settings, it'll be in there somewhere. But you have to have this app to activate the tracking dot in your phone for it. Now, I was going to try and show you guys the app, but I ended up having to use my own personal phone as a camera today, so I can't actually show you. But taking a look at it, it would, in theory, the thought is, let's say that you're in Safety Mart, and someone with COVID, because if I believe the theory is if you have COVID, you have to have the app.
That's what I've heard. If you have COVID, you should have the app. I'm not sure if it's mandatory, but you have to have the app, and then it activates anybody else who has the app if you're in the proximity of them, so that you know that you are in that proximity. And if that app goes off, you don't have to panic, you don't have to shoot anybody. All you have to do is put on your mask, use your hand sanitizer, don't get closer than 6 feet to people, and be a human being.
Well, the interesting thing is, because it does go into detail in the app itself, saying that this doesn't track you, it tracks the fact that somebody in the area has it. So when your phone goes off saying that somebody is near you with it, it doesn't say David has it. It says someone around you within 30 feet
Right.
has COVID. So you can never. So the amount of anonymity. Am I saying that right?
Anonymity. Yeah.
Yeah. Thank you. Is prevalent, but I guess if you, especially in a small town, you'd be able to guess.
Well, you might, and the thing is to me it's irrelevant.
Right.
You know, the thing is that it's there. This is a reminder to be a little safer. You know, this is the reminder not to go up and hug somebody. Okay? This is a reminder to put your mask on. You know, it's not rocket science, you know, and we don't have to panic about it. You know, that's the thing. There's all this fear out there about it when it's just social decency, you know, just being a good friend and neighbor. You know, that doesn't change.
Do you have any comments on the uptick in daily coronavirus cases?
Well, I think that was inevitable. As we get, you know, they were aware that if we got to beyond 70% of pre-COVID contacts, there was going to be an uptick. And the main, from what I've seen, and I haven't seen all of the data, so, you know, don't let me offend anybody here. But the thing is the main places that it has happened is at parties and social events where the groups that were there did not physically distance, did not wear masks, they were not washing their hands regularly, and they were, you know, crowded in and doing all of the things that we know are going to cause a problem if there is one single person there that has COVID.
Right.
And so I'm not surprised, I'm disappointed, you know, but I don't know how we're going to get back to 100% without really making the commitment. You know, like I usually, when I'm on the street in Ashcroft, I don't wear my mask. Well, actually I have it on, but it hangs around my neck. But when I go into a store, before I go into the store, I put it on. Because I don't know who else is in there, and I don't know whether I'm going to be able to go down the aisle and stay 6 feet from people. And I don't want them worried that I've got it. I'm not worried if they've got it because I've got my mask on. So, you know, I just do that as one of the things that Dr. Bonnie Henry has asked us to do. And, you know, in the first months of this, we were able to flatten our curve really easily. You know, for the first 7 weeks of COVID, we were way ahead of Alberta in case numbers. And they're now 3 times ours. You know, but we really got into that we're all in this together and we're all going to survive together by doing what we need to do together.
Awesome. Well, is there anything else that you would specifically like to talk about?
No, I think that's pretty much covered it all. Like I say, when the tracking app gets launched in BC, I will be putting it on my phone.
Well, again, it's available right now. I downloaded it this morning.
Okay,
So.
send me the link so that I know where to go.
Sure.
You know how technologically illiterate I am.
Awesome. Well, everybody at home, this is David Dirksen. We look forward to your next update at some point in the future. And thank you very much for spending the time with us today, talking about everything medical in our rural area.
Appreciate it. And like I say, we're making some really good progress with improving and transforming the system.
Awesome. So if you just take off your microphone and turn off the box, that'd be great. All right, so now you guys are now all just stuck with me. David's going to go home to his lovely wife, Alice. Say hi to her for me, please. And now we're going to get into the normal portion of the show. So, from the Village of Ashcroft, they are saying that individuals who visited Liquid Zoo in Kelowna, BC from July 15th to 18th are asked to self-isolate and monitor closely for symptoms of COVID-19 for 14 days and get tested if they begin to exhibit symptoms. And of course, if you feel that you might have symptoms of COVID-19, you can get checked at our local Ashcroft Family Medical Practice. Also, there are stage 1 water conservation restrictions that are in effect. Even house numbers may water on even calendar days, and odd house numbers may water on odd days. For example, if you live at 678 Ashcroft Lane, you will water on the 2nd, 4th, and 20th of the month, and so on. Watering hours are from 6 to 9 a.m. and 8 to 11 p.m. Thank you for helping lower pressure on our water treatment plant. And that new water treatment plant, from everything I've heard so far, has been amazing in town. So keep up the good work in Ashcroft. Category 2 and 3 fires are now prohibited, but campfires are still permissible. A campfire is an open fire that burns piled material no larger than 0.5 meters in height and 0.5 meters in width. You must keep at least 8 liters of water on hand or a hand tool on hand at all times while your campfire is lit. Before you leave your campfire for any length of time, the fire must be fully extinguished. To report fires, text star 5555 or call 1-800-663-5555. If you are caught breaking the rules, you could face a fine up to $1,150. And if you're watching right now, send me a comment so I can see who's watching, and I will say hi to you live in person. Let me just turn down my microphone here. I'm afraid I'm peaking too much. Test. There we go. Okay, so in Cache Creek, congratulations to Councillor Lisa Defoe for becoming an LPN. I know that's been a long time thing of hers, so congratulations to Lisa. We look forward to hopefully having you in the Ashcroft Hospital setting, if not already, then soon. And a reminder, today is the last day to pay your 2020 property taxes without a penalty. Remember that even if you pay through your mortgage, you still have to bring your signed homeowner's grant in order to claim it. Now, one other thing I should mention during this Ashcroft and Cache Creek session is on Tuesday, we got interrupted by some seemingly alien-ish type cardboard-tonians, and we have a response from the mayor of Ashcroft to that vicious, evil group of people.
We have received a very disturbing communication from a group of creatures known as the Cardboardonians. We have had a message from Commander Corrugated and Recyclon Prime that the villages of Ashcroft and Cache Creek are going to be destroyed. Fortunately, they have given us a date, August 22nd, so we have time to be prepared. Now, they think that we cannot be prepared. They said that there is nothing that we can do unless we have young, strong children to defend us. Now, they do not think we have young, strong children in Ashcroft and Cache Creek, and I know that we do. So I am calling on the youth of our communities to rally and protect us, because you are our only defense. Now, before you get worried that you might not have the ability to repel the cardboardonians, they did give us a valuable clue. They said that water is the only thing that will destroy them. It is dangerous for cardboardonians. They said, do not get us wet. Now, you might think we could lure them to our rivers and creeks, but that is too dangerous. We cannot go near our water courses. However, water guns and forts made out of material that the cardboardonians will understand, cardboard, paper, plastic, anything that can be recycled. If the youth of Ashcroft and Cache Creek will build these forts, will have water guns and water on hand for August the 22nd, you will defeat the cardboardonians and save our communities. We are depending on you. We know that you will not fail us. On August 22nd, you will defeat these creatures and preserve our towns. Thank you.
So be prepared. Be very prepared. This is serious business, folks. Don't let them come and get you without you being ready for them. August 22nd, set up your forts today. The Ashcrofton District Lions Club invites you to the holiday weekend barbecue. Come to the market in Cache Creek tomorrow, not tomorrow. Is it tomorrow already? Oh my goodness, August is already here. August 1st at 9 a.m. to 1 p.m. Support your local Lions Club. Enjoy a burger or hot dog while you browse the flea market. And Shauna Sampson, it is very nice to have you watching the show. Thank you so much for everything that you do. The Village of Cache Creek is accepting applications for on-call temporary laborer positions for public works duties. If and when the Village of Cache Creek requires workers on short notice for short periods of time, those successful applicants who are on the casual labor list will be contacted. All applications must have a valid Class 5 driver's license, and this is a union position with the International Union of Operating Engineers, Local 115. The rate of pay is $26.02 per hour. So that is pretty sweet. If you're interested in joining the laborers in Cache Creek. The closing date for accepting applications is noon, Friday, August 14th, 2020. Applicants must be available for an interview during the week of August 17th to 21st, 2020. Applicants must also include a cover letter, post-related job experience, and 3 work references. Applications should be sent or dropped off at the Village Office of Cache Creek Municipal Office, 1389 Quartz Road. Emailed applications are also acceptable, but the Village strongly suggests that a hard copy be delivered to ensure that they receive it properly. So, as I said earlier, the whole team today is in Lillooet. Now, I have somebody here editing some videos for us for the upcoming Desert Days Music Festival, which is next week, Friday starting at 6 in the evening, I believe, and Saturday, same deal. So, I'm pretty lonely. But in order to get my fill of the team, we have a brief little video from Cedar and the gang, so check this out as well.
Hello, I'm Cedar. I am from Darcy. I am here at the Lillooet Farmers Market with the Hub, and we are walking around taking video and showcasing the farmers market. I hope to show the rest of the farmers markets in upcoming videos.
So thank you from the team in Lillooet. That's awesome. If you want to see everything that they've been up to today, you can go to our Facebook page. They have been posting several pictures as to what's been going on. So check that out. The Interior. So Interior Health says people in BC are advised not to eat red onions imported from the U.S. in response to the ongoing salmonella outbreak. As if 2020 couldn't get weird enough, we now have a salmonella outbreak as well, so please be careful of the red onions. In the province, we have new COVID numbers from Thursday with 29 new cases, and on Wednesday we saw an uptick of 41 new cases. So remember, for now, keep your bubble small. As Dr. Bonnie Henry says, fewer faces, bigger spaces. This means hanging out with the same close friends and family. The more people you hang out with, the higher your risk of being exposed to and spreading COVID-19. Don't share food, drinks, or smokes, and stay home if sick. Do your part. Socialize safely and ask yourself, what would Dr. Henry do? As of July 31st, 2020, visitors from the USA who are traveling to Alaska through BC must have a special hang tag displayed in their vehicle showing their departure date from Canada and follow a series of new rules designed to limit contact with British Columbians. Now, I've seen several different accounts of American license plates that have been, just out and about in weird places or involved in accidents. I believe that the accident that we had here actually had a person from the States involved. So it's nice to see that they are upping the rules a little bit, keeping things a little bit tighter, especially with our COVID cases on the rise. Now, talking about schools, yesterday there was a big meeting press conference, I should say, for what they're planning to do in September for all of our students. And hang on, I'm just going to turn myself down here a little bit more. That should be better. Yeah. Okay, so students in kindergarten to grade 12 in BC will return to classrooms in September with a new cohort or learning group system. In learning groups, a limited number of students and staff will stay together throughout the school quarter, semester, or year and interact mostly with each other. Learning groups will have elementary and middle school students will have 60 students and staff. Secondary schools will have 120 students with staff. There will be less physical contact, fewer shared spaces, and schools will also have measures in place to keep students and staff healthy and safe. And so from School District 74 specifically, this is from yesterday, they say that today's announcement from the Provincial Health Officer, Dr. Bonnie Henry, and Minister of Education, Rob Fleming, has established that all students, kindergarten to grade 12, will return to school full-time in September with Stage 2. Now, what's interesting about this is, like with just COVID in general, as the stages get bigger, it means that we have more freedoms. But with this, we are, the higher the number, the less freedoms there are. So it's an interesting flip. It took me a second to sort of wrap my head around it. Anyway, BC's restart plan, we look forward to welcoming everyone back to school, and detailed plans that will outline the health and safety provisions for students and staff will be shared in August. So through all of this, of course, if you guys have anything that you would like to say on any of these topics, please enter it into the comment section below or send us an email at hon@ashcrofthub.com. We would love to hear from you about what your thoughts are on any of these subjects. So please share that with us today. Now, something going on, so now some stories from the country as a whole. We've talked about Ashcroft, we've talked about the interior, we talked about the province. Let's look at the country. So Canadians can now begin downloading the voluntary smartphone app meant to warn users that they've been near someone who tested positive for COVID-19. Now, again, I was wanting to show you guys what the app actually looks like, but my phone is being used as a camera. So I can't, but you can go check it out. It's really easy to find. You just go into the App Store on your phone and you just type in COVID-19. It should be the first or second thing that pops up. And now this is if you're interested. I know that there's a lot of controversy surrounding this app. Again, as I spoke about with David, the different types of privacy that it takes, how many people are actually going to use it. And again, let us know what you think. Are you going to use this? Are you not going to use this? Maybe we'll make this a poll on our Facebook page. But overall, interesting idea, if nothing else. And I'm going to I'm personally going to try it as an experiment and just see what it's like. I don't know if I necessarily would endorse this, but we'll see what happens. I'll let you guys know on Tuesday what it was like having it on over the weekend. Sorry. Now, following one of the big stories that's been going on, of course, over the last couple of weeks is this We Charity scandal that involves our Prime Minister, Justin Trudeau. So Prime Minister Justin Trudeau said he downloaded the COVID alert. Oh, hang on. I'm going to go back to the COVID app. Justin Trudeau said he downloaded the COVID alert app Friday morning and said the more people who sign up for it and use it, the better it will be to be able to trace and help to slow the spread of the novel coronavirus. Health experts say that if enough people sign up, this app can help prevent future outbreaks of COVID-19 in Canada. Trudeau said Friday in Ottawa during a visit to the Public Health Agency of Canada. The app is designed to track the location of phone relative. The app is designed to track the location of phones relative to each other without collecting personal data, anywhere centrally using digital identifications unique to each device. Now that is what happens in the very second page of this app. It does ask you a bunch of questions whether you. It tells you that it's not collecting data. It tells you that it doesn't use your GPS. It just pings phones without telling you who's there. But again, I will try it over the weekend, see if anything happens, and report to you guys on Tuesday. Watch Tuesday at 3. Now we're going to talk about We Charity. So I watched most of a cross-examination by a committee that isn't the Ethics Committee. This was several members of the House asking Prime Minister Trudeau questions in regards to this We Charity scandal. I have seen Trudeau do this. So this is interesting. So I have seen Trudeau do this kind of tactic before in the past when he was faced with other ethics commissions before. So both sides, both NDP and the Conservatives, had time to ask him questions. One person was asking the Prime Minister pretty point blank, how much was your family getting paid by We Charity? And as a tactic, Prime Minister Trudeau said anything but the number. He didn't say that he didn't know the number. He didn't say he knew the number. He just talked about his family and how good they are and that kind of stuff. So Justin never answered the question. He just talked about a lot of other things, but never gave a straight answer. Same thing with the representative from the NDP. A direct yes or no question was asked, and there was no real clear answer that was given. This is an interesting thing about this tactic is that it runs out the clock. All of these people that only have so much time to ask and answer questions never really ask anything other than the one question that they're trying to get an answer from. So I have all this written down, and I'm trying not to lose track here. So the interesting thing about this tactic is that it just runs out the clock. All of these people only have so much time to ask and answer questions. Typically 5 minutes when you're asking questions and 14 seconds for Justin Trudeau to answer. Another thing that I find amazing is that you would think that the Conservatives and the NDP representatives would know what he is doing and move on and ask other questions that Trudeau wouldn't answer anyway. But that at least puts the questions out there into people's minds. But no, they ask one question over and over and over again, killing their 5 minutes. Anyway, it is both funny and difficult to watch. The Prime Minister deflect the questions in this way, but his skill to just keep going is oddly inspiring. I will be interested to see what he is like when he is actually with the Ethics Commissioner. He could have just said that I don't know the answer to these questions. I'm also surprised that there isn't some kind of a judge that can intervene and tell him to just answer the question, or to tell the representatives to stop that line of questioning. But I guess this isn't a courtroom. Anyway, the Prime Minister is scheduled to speak with the Ethics Commissioner again, and we will keep you up to date with all of the new details as they come out. So Yeah, it was very interesting to watch. You can find all of these different clips and videos on YouTube. So please, if you have, and they're all typically 7 minutes, 10 minutes long. They've broken it up into sections. So go check that out if you want to see something interesting. There was a good one a few years ago where he was being grilled in the House of Commons, and he just literally said over and over and over again, I look forward to speaking with the ethics commissioner. And everybody on the other side of the aisle just kept asking them the same question, and he gave the same answer. Probably for 15 minutes was that particular clip that I saw. Anyway, on the 29th, MP Brad Viss tweeted that Prime Minister Trudeau handed almost $1 billion to a charity that paid multiple family members approximately $500,000. He has repeatedly tried to use the pandemic to amass power for himself and his friends. Trudeau must come clean to Canadians at FINA tomorrow. Now that was from a couple of days ago, so he's referring to the show that I was talking about just a few minutes ago. And Jackie Taggart tweets that the NDP have been in power for over 3 years, and they're still blaming the previous government for their failures, the BC Liberals. And this is in regards to handing off of the Site C on time and on budget. So Site C, I'm not sure what that is. I'm just trying to pass along what our local MLA and local MP have been saying. So that is that. Now, we also have a bunch of new furniture in the room here. So I want to thank Kevin and his wife for bringing it in. I'm sorry I missed you guys both yesterday and this morning. And last but not least, Wendy Weeb, welcome to town. And if you're watching, we hope that you're doing fine. Have yourselves a good day, everybody. Have a great long weekend. We'll see you Tuesday at 3. Thank you to David. Thank you to you. See you later.